Excuse me. Now tonight, I wanted to talk to you about the dangers of drug medication. Now over here we've seen a number of drugs shown here. Just tonight, before I came here, I was talking to a lady on the telephone. My brother called up from Living Valley Springs and he asked me if I could call a lady who needs to come for treatment. The lady's 68 years of age and she's got rheumatoid arthritis. They've put her on a drug that's like a chemotherapy drug to try and control the immune system, because rheumatoid arthritis is really an autoimmune disease. It's where the immune system is overreacting because of some influence in the body. Often we've found that that influence could be simply mercury fillings in the teeth, or infections in the jaw, or exposure to various industrial and agricultural chemicals over the years. But for some reason, the immune system of the body has become hyped up and the person's getting inflammation and pain. So they've got her on a drug to try and bring down the immune system. They've also got her on cortisone, and then she read off a whole list of other drugs. A lot of them I've never heard of. And then she started to tell me her side effects, and she's just getting worse. In fact, since she's been on the drugs, her condition is worse, and she's not in so much pain. She sweats all the time. She's put on massive amounts of weight. She's got no energy. She gets headaches. She feels sick. When she takes some of these drugs, she feels like vomiting for several hours. It just gets worse and worse. And what we find is that a lot of people go to the doctor for one problem and they get prescribed a drug for that problem. They take that drug for some time and that drug causes side effects. They go back to the doctor with their side effects and they get prescribed another drug for the side effects. And so it goes on and on. And I remember some years ago a young girl came to our clinic and she said that she had severe headaches, she had chronic fatigue, she had sinus problems, aches and pains throughout her body, and quite a number of other symptoms. We found she was taking 4 drugs. Now, as we went back through them, one drug was prescribed for her 4 years previously because she was having menstrual pain. Now, the drug for the menstrual pain caused side effects, which was the headaches and a few of the other symptoms. She went back to the doctor and he gave her another drug to cope with the side effects of the first drug and told her to continue taking the first drug as well. The second drug caused side effects, so she went back to the doctor and she ended up with a drug to cope with the side effects from the second drug. By this stage she was taking 3 drugs. The third drug caused some major side effects and she ended up on a 4th drug to try and cope with the side effects of the third drug. And I can tell you that I meet people in this condition all the time. People come into our clinic and they often give me a whole page full of the drugs that they're taking. And you go back through them and one drug is simply to cope with the side effects of another drug and so on, right back down the line. So we took her off all the 4 drugs and we treated her menstrual problem just with herbs and lifestyle, and all the symptoms went away within a few days. We see this many, many times. Now, the writer of the book that I held up last night called The Ministry of Healing, back in the 1800s, she made a very bold statement. She said, drugs never cure disease. They simply change the form and location of the disease. Now, if disease is an effort of nature to free the system from conditions that have resulted from violating the laws of health, then disease is generally a toxic build-up in the system. As I said on Monday night, if I was to take a little bit of flesh from any one of you and take it to the microbiology lab and have it tested, we would find that it probably contains toxic amounts of various chemicals, industrial insecticides, fertilizers, lead, and so on and so on. Whatever that you've been exposed to in the air you're breathing, the food you're eating, and so on, the water you're drinking, these things do build up in the system. If you've been taking medical drugs, we can be sure that there's going to be fairly high amounts of those drug residues in your tissue somewhere. We've had people that have come and done our 10-day cleansing program, and on the 7th or 8th day, they have wanted to sleep all the time. So I've started to inquire what they used to take in the years gone by. We had one lady said that she went through a difficult time in her life about 6 years ago, and she took a lot of sleeping tablets. But she stopped taking them about 5 years ago. Hadn't had a sleeping tablet for all those years. When we put her on a detoxification program, by the 7th day, the sleeping tablets were starting to come out of her system and she just wanted to sleep all the time. We couldn't wake her up most of the time. We just had to come and keep waking her up, drink the juice, and she'd go back to sleep. After 2 or 3 days, we finally got all of that out of her system and she cleaned up. We've had people, a drug like marijuana, for example, it's got a very sticky resin and it stays in the system for many, many years. In fact, I've got studies now showing that marijuana is one of the most toxic, poisonous substances you can put in your body for your long term. It reduces mental capacity. The sticky resin builds up in brain cells. I had a lady come many years ago to do the 10-day cleansing program. She went along fine. This lady had a very poor eliminating system. She was 37 years of age. She was very pale, very thin. She had very sluggish bowels. She had poor lung action. She didn't exercise much. She didn't drink a lot of water. So her elimination system was very impaired. On the 9th day of the program, she was on the ground. I went up and I said to her, "Are you okay?" She said, "I'm stoned." I said, "What have you been taking?" She said, "I haven't been taking anything," but she said, "I just feel like I've had a fresh joint of marijuana." I said, "Well, how long since you've smoked marijuana?" And she said, 16 years. She had not smoked marijuana for 16 years. As a teenager, she smoked a lot of marijuana. Now here, 21 years of age, she'd stopped smoking it. 16 years later, she does a detoxification program and the resins start coming out of the system into the blood to be eliminated, and she gets the complete effects as if she just smoked it fresh. But the interesting thing was that we could smell it on her. She had the smell. We picked her up, put her into the steam sauna and gave her a lot of steam baths, some vitamin C and a lot of herbs to really speed up the cleansing, and she came out of it. Then the next day she went back into it again, and for a few days she was in and out of this stoning crisis, and it took her some time to really clean that out of her body. She's a fit, healthy, happy lady now. Got much better colour in her face, and she's keeping the 8 laws of health. We've seen this over and over again. Even farmers that have been exposed to chemicals, on the 7th and 8th day, you can smell the chemicals when they go to the toilet during our cleansing program. But particularly medical drugs. I've had many patients have come to me on the 7th, 8th, 9th day of the program and said to me, "Do you know, when I opened my bowels this morning, the smell in the toilet was just like the drugs I used to take some years ago for some condition that they used to have." Or they've said that it's like a massive amount of the drugs that I only stopped taking last week when they arrived at our clinic as these drugs come out. So we need to understand that a lot of these poisons, they get stuck in the body. They stay in the fatty tissue, in the organ tissue. It's a lot of trouble to get them out. I remember one morning I was walking down. In fact, we'd just given our patients a liver cleanse program the night before. And so this particular morning, what they'd passed into their toilets was very, very toxic. Their liver had had a good flush. And there was a couple of farmers on the program that had been using 2,4-D. And I walked down the hill from my house and I said to one of the staff, I said, "One of those local farmers has been spraying 2,4-D around here." And it turned out that it was just simply the toilets where these two men, we'd had them pass their waste matter into buckets that morning and leave it in the bathroom so we could have a look at it. Doesn't sound very nice, but some parts of our job are not so nice. But the smell of the 2,4-D was just wafting through the air quite strong. And these men had just been using these chemicals for years. So with drugs, when we take drugs to suppress symptoms of disease, we don't actually cure the disease, we simply change the form and location of the disease. And I first was made aware of this many years ago when I ran my first 10-day cleansing program in North New South Wales in about 1987. And one of the patients that I had there was a 66-year-old man who had emphysema. Now, emphysema is a lung disease where through smoking we've killed off the little hairs that are called cilia that are always moving upwards, sweeping upwards. What we do, we produce mucus at the base of these hairs in the alveoli sacs in our lungs. It sits on top of the hairs, so that when we breathe in dust and so on, it gets caught on the mucus, and the little hairs called cilia sweep the mucus up, and we cough it out or we swallow it. We don't even really know about it. It's just a natural action that's taking place in our body all the time. Now, people who smoke a lot, they kill off those little cilia, the little hairs, and the mucus still gets produced. It flows down into the sacs in the lungs and makes them get bigger and bigger and bigger until they burst. And then we find when they breathe, they're passing air straight through into the cavity of the body and then breathing it out again. And they're only getting a percentage of the oxygen that they need. And in fact, we find that some people with emphysema are only getting 30% of their oxygen. So they find they can't exercise, they're very tired all the time. Now, this man, he had severe emphysema, he had smoker's cough. He hadn't smoked now for some years, but he developed the emphysema and he was coughing all the time to the extent that he was bothering the other guests all during the night with his coughing. We had to put him in a room out the back so that he wouldn't wake everyone up. Now, during the 10 days, there wasn't a real lot of improvement. We detoxed him, we used steam saunas, we used massage, and we used lymphatic drainage treatments. We used juice fasting and herbs and so on, and we really got his body cleansing. We gave him a liver tonic to really clean the liver. Anyway, he went home, and the very next day after he got home, he called up and he said, "I think you better come over." He didn't live very far away. He said, "I'm breaking out in boils." So we went over, and he was breaking out in boils all down his wrists, big boils. Within a few days, he had gigantic boils all around his groin and all down the wrists and the tops of both hands. And he said, "You've done this to me." He said, "I was perfectly fine until I came to your clinic. It's something you've given me has caused me to break out in boils. Now, I'm going out to the doctor. I'm going to tell him what you've done to me." And I said, "Look, don't go to the doctor, because the doctor's going to give you a drug to suppress whatever's coming out." I said, "Disease is an effort of nature." I said, "Those boils are simply your body is cleaning something out. I don't fully understand it. I can't explain it to you, but we need to run with it. We need to assist nature to clean out the muck." And anyway, he sort of believed me a little bit, so he allowed me to treat the boils with poultices. Now, I talked about poultices last night. We used potato poultices, we used clay poultices, we used all sorts of poultices. And the more poultices we used, the worse the boils got. And they just kept, this pus, this stinking pus just kept coming out of his wrists and out of his groin. He was in a lot of pain. He was very uncomfortable. He was very angry. And he was almost going to go to the doctor every day. "Oh, I'm going to go to the doctor." And I said, "Don't go to the doctor." Anyway, finally, after 6 weeks of agony, they started to clear up. Anyway, gradually they all cleared up, and his hands healed, and he was out of pain. And he said, "Do you know why I didn't go to the doctor?" I said, "Why?" And he said, "Because I noticed that the more pus came out of those boils, the less coughing that I had." And he said, "Have you noticed I haven't coughed for nearly 2 weeks?" I said, "Is that a fact?" He said, "I feel terrific. I've got so much more energy. I can get up this hill now. I can breathe. I'm not congested." He said, I think that the poison in my lungs has come out my hands and my groin." Well, little did I know that that was exactly what had happened at the time. I didn't fully understand it at the time. But his body, because we had instigated a cleansing in his body through giving him juice fasting and herbs and steam baths and so on, his body was strong enough. He's got a very strong constitution. It started to move the poisons out of the lungs into the blood, and we just chose the groin and the wrists. I don't know why it chose that part of his body. With different people, the body will choose somewhere else to eliminate poisons, but that was where his body started dumping the poisons. It broke out in these boils, and the more pus came out, the more these lungs got better, until these lungs were clean enough to start mending themselves. See, the lungs were unable to mend themselves when they were in such a toxic condition, with all that tar and nicotine all built up in the tissue of the lungs. Now, I saw that man only about 1.5 to 2 years ago down in Lismore. He's now about, what would he be, about 78, 79 years of age, and he's healthy and strong, and he's never had a recurrence of emphysema. He stuck to the 8 laws of health, and he's maintained the condition that we established. Now, what I've written on the board here, it's a study of toxicology. I'll just take this off here so I can go over and explain it. Now, across here we have 6 phases of disease. We find that you can fairly well categorise disease into 6 phases. The first one being excretion. When we have exposure to toxins, to poisons of any sort, our body will make an effort to excrete them right away. If we've got a strong constitution and we're healthy, the body will start eliminating via vomiting, through the bowels. We'll get diarrhoea. We could come out in a sweat and start opening the pores and eliminating those poisons through the skin, or we may even start eliminating the poisons through the lungs, through mucus coming out. But these are all excretion actions of the body. Now, if we take a drug to suppress that excretion, well then we simply change the form and location of the toxin. We move it into a deeper part of the body. Now down here we have 4 levels of tissue within the body. We call these the tissue phases. We've got the outer phase, which is the skin, the digestive system, some of the lymphatic system, the mouth, and most of the outer parts of the body. Here we have the inner parts of the body, such as the mucous membranes, the respiratory system, some of the organs of the body, some of the deeper lymphatic parts of the body. Down here we go into the deep tissue of the body, where we're looking at the endocrine system, the bones, the deep lymph system, and any of the inner tissue of the body. And down here we have the cellular phase, which is the inner cellular tissue of the body. This will also include the kidneys, the blood serum, the germ cells of the body, and these areas are right down where we're affecting the DNA and the RNA, the computer systems right within the inner cells of our body. Now, as we start to suppress the body with drugs, we suppress the poisons, we're pushing them deeper into the tissue. And this is seen many times. I'll give you a typical example. It was a lady that came to us some years ago. During the original interview, the consultation, she told me that she used to suffer from ear infections. She said, I've had so many ear infections. From a young girl I've been getting them, and she said, I've taken so many antibiotics. You wouldn't believe how many antibiotics I've taken. And she said, the doctors came up with a new one about a year ago, a very strong one. It seems to have knocked it on the head. I haven't had an ear infection since. Now, my immediate thinking was, oh no. Because she was coming in to do a 10-day cleansing program. If she's been suppressing ear infections for 20 years with antibiotics, what crisis is going to occur during our 10-day cleansing program? You see, when I first started running 10-day cleansing programs, about 1987, that's about 12 years ago, sometimes I would see things happen that the people didn't get better, they got worse. And I used to get quite concerned, and I thought, what am I doing to these people? I'm supposed to be getting them better, they're getting worse, until I realised that they were simply going through a regression of their toxic state. The poisons, as they were coming out, were causing symptoms that made it look like they were getting worse, but they were really getting better. Now, this particular lady, I said to her, now, let me know if you get any pain or infection in the ears during the next few days. Let me know straight away. She said, well, why would you think that would happen when I've come here? I've come here to get healthy, not ear infections. I said, well, it's possible if you've been suppressing toxic waste in the inner ear with antibiotics that when we start cleaning you up, that stuff might start coming out. She said, well, I certainly hope not. 3 days later, after 3 days of juice fasting, steam saunas, massages, and herbs and so on, she came and said, look, I've got terrible ear infection in both ears. So we immediately got potatoes, grated the potatoes, made little sacks out of chucks, put them on the ears, and we wrapped her up this way, and we had a bandage around this way. She looked like she was in a brain surgery ward. And she didn't hear anything for the next 7 days because we kept changing those poultices every 2 hours. And the pus just started coming out. In fact, there was pus flowing out of both ears. And it was the worst infection she'd ever had. And she had a lot of pain with it, a lot of discomfort. In the evening, we would heat up an onion, and we would wrap that up and put that on both ears, an onion on each ear, and that would warm up the ear and relieve the pain so she could go to sleep. But every time we changed those potato poultices during the day, they would stink, and they were full of pus. and it just kept happening. Now, after about 6 days, it started to ease up, and it cleared up very quickly. And by the 10th day of the program, the lady had very clear ears. And she said, I don't think I've ever had such clear ears as I have now. My hearing seems to have improved considerably. But she said, not only that, my thinking has improved. I feel really clear and sharp in the head. And her eyes were clearer, and her skin was clearer. A sinus had all cleared, and she had suffered also from headaches. Now, I believe that if that lady had have continued to suppress her ear infections with antibiotics year after year, that she was a candidate for something more serious like a brain tumour. Because that lady was, for some reason, dumping a lot of toxins in the cranial area of her body, up in the head. The body was using the ear canal as a means to get rid of a lot of toxic buildup. Each time it started to come out through the tissue, it would inflame the tissue. She'd run off to the doctor and take drugs. She needed to let it come out. We also needed to balance the body so that she would get rid of a waste through better channels, such as the bowels, the skin, the lungs, and the kidneys. And that lady went home very, very happy, and what an ordeal. She came to a health retreat to have a rest and went through one of the greatest ordeals she's ever been through. Another example of this was my own daughter. Now, I have a daughter named Giselle. She is the cook at Living Valley Springs, and she does a wonderful job up there, runs that entire kitchen, and she's been running that kitchen since she was about 15 years of age. And she gets very busy. She has a fairly busy social life, and you know, at that age, she's nearly 19 now, and she forgets to drink her water sometimes. And sometimes she gets so busy she doesn't do her exercise. And a couple of years ago, there was a wedding. And the wedding, the people getting married are actually here using the cameras here at the moment tonight. But they were getting married, and Giselle was going to sing at their wedding. Now, a few days before the wedding, she was so stressed out, and she was overworked running this kitchen, and she wasn't drinking her water, and she wasn't doing her exercise. And she got an eye infection, conjunctivitis. Both eyes became severely inflamed. And she came to me and she said, Dad, look at my eyes. I can't go to the wedding and sing in this condition. What can you do? I said, well, we need to get you drinking a lot of water. We need to juice fast you for 2 days, some steam baths, and we need to put aloe vera drops in your eyes. And in the evening, we'll put potato poultices on your eyes. Dad, you just don't understand how busy I am. I haven't got time to do this sort of thing. I'm so busy. I said, now, do you want to clean up those eyes or not? Oh, she said, I'll give it a go, but I just haven't got time. So anyway, she didn't do anything I told her. So finally, the morning of the wedding came, and off she went to the doctor. I said to her, Giselle, if you go to the doctor's going to give you eye drops, which are drugs, which are very poisonous, and they are going to simply change the form and the location of the toxins that are in your eyes that are inflaming your eyes. I said, they're going to shift it around, and you're going to pay for it later because it's going to come out somewhere else in your body. And she said, well, that's okay, Dad. She said, I don't mind. So long as I can shift them out of the eyes, I'll get wherever they come up next time, I'll get rid of them there. But she said, this is an important wedding. I've got to look all right for this. She said, I don't mind if we can just shift them out of the eyes, I'll be happy. So off she went to the doctor. She got the drugs, put the drugs in the eyes, and by the afternoon, 2 o'clock in the afternoon, she looked fine. The drugs worked very quickly. They took away the inflammation. They shifted the poisons. She sang well at the wedding. And then a few days later, she had to go to Western Australia. Now, the reason she went to Western Australia was because one of the girls that used to work at Living Valley Springs was getting married and asked Giselle if she'd come over there for 2 weeks to help her get ready for the wedding and then be her bridesmaid. So Giselle flew off to the West, and she was only over there for about a week, and she called me up and she said, Dad, you wouldn't believe what's happened to me. I said, what's happened? She said, I've got glandular fever. I said, you couldn't have glandular fever because glandular fever is more right down here. It's more of a serious disease. She's a healthy girl, breaks a few of the laws of health sometimes, but I would imagine that she would only have excretion and reaction taking place in her body. When we're getting down to deep glandular diseases, we're looking down at impregnation of toxins. And I'll go through this a little bit more clearly in a minute. But I said to her, you couldn't have glandular fever. Who said you have glandular fever? She said, I've been to a doctor. She said, Dad, my neck is as big as my face, and my face is all swollen. And she said, and I've got a rash all over my chest, And she said, and they want to put me in hospital today. I said, don't you go near that hospital. I said, you have not got glandular fever. I said, you're reacting to those eye drops. Oh, no, Dad. She said, I only used a total of 15 drops in each eye over a period of 5 days. She said, they couldn't possibly do this. I said, tell me the name of the eye drops. So she told me. I went and got the medical book. I looked it up. And I called her back and I said, now listen to this. It said, these drugs may cause side effects which can occur between 2 weeks and several months after the use of the drug. Side effects may include severe swelling to the neck and face, rashes on the chest, and arthritis of the hands and feet. I called her, when I talked to her, she said, I didn't tell you about that. I can't move my fingers either. Yeah. So I said, okay, well, what you need to do now, you need to go on water for 2 days. Have a steam bath, give yourself an enema. Really get that body cleaning, siphon that poison out of the body. I said, and then go on juices for 2 days, and then get back onto your food, and you should be ready for the wedding, and you'll be fine. So she did exactly what I said, and on the 3rd day she called me and she said, oh, Dad, this fasting's really worked. My neck's completely cleared up, so's the face, so's the chest, I feel great. She said, I'll keep juicing for another day, and then I'll go back onto food and I'll be fine for the wedding. I said, good. The day before the wedding, she calls up, she said, Dad, you wouldn't believe what's happened now. I said, what's happened? She said, the eye infection's come back. You see? So then she went along to the wedding with the eye infection and had to be bridesmaid with these awfully inflamed eyes. She came home, she said, Dad, I'm never, ever going to take a medical drug ever again in my life. See, that was the first exposure to medical drugs. Now, that's exactly what they do. They cause problems on the way in, and then when you start cleaning the body up, it causes problems on the way out. Why do you think that she had such a severe reaction to those drugs? First time she's had the drug, and also because she's very healthy. She eats a very good vegetarian diet. She normally drinks her water. She does a bit of exercise. She goes to bed reasonably early. She keeps the laws of health. She's very healthy. When you're healthy, your body's eliminating system is going to react immediately to the inducement of poisons. See, now, a person who's been eating hamburgers and fries and hot dogs and Coca-Cola and going to bed late and doing everything wrong, and they go along and they take those eye drops, it'll have no effect on them. Because their body's already so toxic, a few more toxins isn't going to make that much difference. It's true. Now, as we look here, we see that if we push poisons down into the body deeper, sooner or later we're going to get a reaction. We might get rid of the symptoms here for a period of time, but we're going to pay for it later on. Those toxins are going to move around in the system, and we're going to get a reaction down here. Now, if we then go along to the doctor with this reaction, the original thing may have been something like a fever or a bit of diarrhea, whatever. We've gone and taken Lomotil or some drug. We've got rid of the symptoms, but 6 months later, we get a flu. Our mucous membranes become inflamed. We've got green mucus coming out. The green mucus is simply the muck coming out of the body as the liver cleans out its bile and so on and puts it into the blood. Excessive amounts of toxic bile get transported to the lungs, gets mixed with the mucus in the lungs, and we cough it up. And it's just simply filth coming out of the body. But we go along to the doctor, he says we've got an infection, he gives us antibiotics. Then we simply push those toxins back down deep into the tissue to some other part of the body until maybe 6 months or a year later we get another infection of some kind. It can be swollen lymph glands, it could be some sort of an organ problem, inflammation of the kidneys or whatever, but it's something further down here. Now, in the first 3 phases of disease, we're mainly dealing with body fluids. If we keep suppressing disease, and it may not even be from taking drugs, we can suppress toxins simply by maintaining a toxic lifestyle. We might get the flu, and we think, well, what the heck, I just keep eating my hamburgers, drinking the Coke, eating all the sugar, and doing everything wrong. Well, just that alone, the body will say, well, what can I do? I'm trying to get rid of all this poison. The harder I try to get rid of it, the more that comes in. You imagine if I'm over here cleaning up the floor with a vacuum cleaner, and someone keeps throwing dirt in, and I clean it up again, they throw in another bucket of dirt, and I clean it up again. Eventually I'm going to burn out, so's the vacuum cleaner. You see, and sometimes the body just gives up. It just says, well, we can't get rid of these poisons. Let's just shift them into a deeper location in the body. There was one boy that had eczema all over his neck and face and the upper part of his chest. And he went along to a doctor. The doctor said, well, we can fix this. He prescribed for him prednisone, a cortisone drug, a steroid. Within a few days, the skin started clearing up. The parents were very happy. This is wonderful. The boy had been embarrassed at school for a long time with his severe eczema, and now it was all clearing up. He started to put on a bit of weight, which was just fluid retention, a side effect of the drug. Within 2 weeks, he developed asthma. So he went along to the doctor, and the doctor wanted to give him the asthma drugs. So the parents didn't want to do that. They said he's too young to go on so many drugs. So they took him to a biological doctor in Germany. This was actually in Germany, this story. I've seen it on a video. And the biological doctor who videoed it put him on a cleanse and to detoxify the poisons that would build up in his system. Within a week, the asthma cleared up. Then, about a week later, he broke out in the eczema again. So the doctor then filmed him with the eczema, and he said, now we're going to continue cleansing him until we clean that skin right out. You see, the cortisone did not take care of the skin problem. It simply pushed the poisons deeper into the tissue, and it somehow affected the ventilation. It made the lungs toxic, and he ended up with asthma. Now, when we get down here, we're dealing with the body cells. We're impregnating poisons into the deep tissue of the body, eventually causing degeneration and ultimately neoplasm, which is where we start to mutate cells and form other filter systems within the body, which we call tumours. Now, over in America some years ago, in California at a university, they took a very big cancer and they somehow ran chemically toxic blood through the cancer, through all the blood vessels that were in the cancer, and it came out relatively clean. They concluded that cancer is the body's effort to produce another filter system. You see, your liver is trying to clean the blood all the time. If you're constantly overloading the body with toxins and your bowels aren't getting rid of it, and you're not doing enough exercise, you're not drinking enough water, so you're not cleaning the poisons out through the kidneys, you're not getting the poisons out through the skin or the lungs, eventually the body's going to get right down into this condition down here, and we're going to start mutating cells. The body will run a lot of blood vessels through these tumours, and will start filtering out the poisons into these tumours. And so even cancer is an effort of nature to free the system from conditions that have resulted from violating the laws of health. And so when we're dealing with cancer, we don't want to kill the cancer as much as what we want to do is clean the body up so the body doesn't need the cancer anymore. And that's how we deal with that disease. We detoxify the body. We get the bowels working properly, the liver working properly, we get the kidneys working properly, in the skin and the lungs. And then we find that ultimately we see cancers just starting to reduce in size and clear up. And we've seen this. There's a book I've got over there called Food for Life. It was written by a woman whose husband had the lymphatic cancer. He had non-Hodgkin's lymphoma, and we cleaned up his body, and within 18 months he had a clean bill of health. No cancer in his body. We didn't specifically aim at the cancer. We aimed at the toxic problem in his body. People do not die from cancer. People die from a chemical imbalance in their metabolism. Right? From breaking the laws of health over a long period of time, or from being exposed to very poisonous chemicals, mercury and other poisons, people will eventually develop tumours, but the tumours are just a side effect of the chemical imbalance in their body. And you often see people that have got cancer, they end up dying, but there's no reason why the actual cancer killed them. The cancer may have been in an area of the bowel where it didn't actually stop them excreting, it didn't do anything to their blood, but they died, and the death certificate says they died of cancer. But they didn't die of cancer. The cancer was simply another symptom of their imbalanced metabolism. So when we're dealing with cancer, we deal with the metabolism. You see, someone asked me last night, they'd seen a lot of people drink a lot of Coca-Cola and they'd never seen anyone die from Coke. But the doctors will never put Coca-Cola as the cause on the death certificate. It's the Coke, it's the white flour, it's the fats, the fried foods, the lack of exercise, the lack of water, and the lack of rest, and the emotional conditions of people that cause these imbalances in the metabolism that eventually lead to these other diseases. But it's the lifestyle that's killed the people, you see. Now, a very interesting case I had some years ago was a lady, 26 years of age, and she had arthritis, really bad in the hands. She was fairly immobile. She was so weak that she couldn't even change the clothes of her two little boys. She'd been getting worse for 16 years. She'd been to doctors, she'd been on a lot of drugs. A lot of money had been spent on investigating her problem in the hospitals. And she just kept getting worse. So she came to us and we put her through a 10-day cleansing program. On the 9th day, there wasn't much improvement at that point, but she went into one of the cooking classes that Debbie was running, and Debbie called me up in the office and she said, "You better get up here quick." She said, "This lady's just run outside and she's collapsed on the ground and she's screaming out, and all the other guests are all around her and they're rubbing her legs and her arms and things." So I went running up there, and there's this lady on the ground, she's screaming, and she said, "This is it, I'm dying, I'm dying." I said, "What's the matter?" She said, it's my elbows." "No, it's my knees." And then she said it's her ankles, and then it was her hips, and she just kept telling me about where the pain was. And the other guests were there madly rubbing the sore parts of her body. And she said, "I know, this is it, isn't it? Finally, I'm going to die. I'm going to die here." And I said, "No, you're not going to die." I said, "This is good." And she just stopped, and everybody looked at me, and she said, "Well, if you say it's good, then I'm happy." And I said, "It is good, Nadia. I don't know what's going on, but something's coming out of your body, and this is a crisis, what we call a healing crisis. Don't be concerned. This is wonderful." I said, "We're going to get you into the steam bath now, and we're going to get this stuff right out of you, whatever it is. I don't know what it is." So we picked her up, put her in the van, drove her to the steam bath. We fired up the steam bath. We got her in there. The other guests all jumped in there with her, and they're all rubbing her elbows and her knees, and we couldn't get her out of the steam bath. When she got too hot, we just took the hose in and hosed her down. And we did this for 2 hours. We got up a good sweat, and then we'd cool her down with cold water. Got up a good sweat, cooled her down with cold water. Now, the other thing I did was I gave her 5,000 milligrams of vitamin C in some juice immediately, and then I gave her another 5,000 milligrams of vitamin C every 15 minutes for 2 hours. Now, that meant that in 2 hours, she'd had 40 grams of vitamin C. The reason I did that is because vitamin C is a wonderful antioxidant. It's a detoxifying agent, and it will neutralise a lot of poisons. And I also wanted to stimulate a good bowel movement to get out what was ever trying to come out. So 2 hours later, she's still in the steam bath, and she called out and she said, "Toilet. I need to go to the toilet." So we picked her up and we took her to the toilet and closed the door, and she was in there for a little while. She finally came out, and she looked perfectly normal, and she said, "You wouldn't believe what just came out of me in that toilet." I said, "What came out of you?" She said, It's deodorant. It's orange deodorant, the stuff my father used to spray under our house in New Guinea every 6 months." I said, "Tell me more about it." She said, "Well, when I grew up in New Guinea. We were in a very bad white ant area." And she said, "My father used to get under that house every 6 months and spray the hole under the house with deodorant to keep the white ants away, and we used to get sick. We used to get the flu, runny noses, headaches for weeks every time he did it." But she said, it was an orange substance, and she said, "And the smell, I'll never forget the smell, and if you stick your head in that toilet room, you will smell that smell. That's deodorant." I said, "Well, I'd rather not." But I said, "I'll take your word for it." So the other guests are all happy. They're all clapping, and they're saying, "What a victory, this is wonderful." And here she was looking perfectly normal. And I said, "Well, look, don't get too excited, because I'd had experience before with similar cases." And I said, within a few hours or a few days, we're going to see a repeat of these crises. The sooner the better. That night, she went into another complete repeat. On the ground, agony, back into the steam bath, another 40 grams of vitamin C over 2 hours, another visit to the bathroom, and another lot of deodorant came out of her. We then put her to bed, and I had one of the girls sleep next to her, and she gave her charcoal water every half an hour through the night. And the poor girl was up every hour going to the bathroom, just passing out what ended up being black because of the charcoal, but it was just deodorant coming out of her body. It's incredible how much poison the body can retain in the tissue. It's just quite amazing. And this girl, we kept her there for 13 days. We sent her home for 7 and got her back for another 10 days. And we just repeated the treatment until we settled her right down, got her body metabolism back into balance. And she finally went home. Within a few weeks, she's running 10 kilometres 3 times a week. She's swimming every day. And she went and did a course in deep tissue massage, set up a clinic. It was quite amazing. And she still has a problem. I see her quite occasionally, but the problem is that she's damaged her adrenal glands somewhere along the line. Those poisons have done a lot of damage. And she's perfectly fine provided she does not come in contact with chemicals. But she has high chemical sensitivity, and when she comes in contact with chemicals, even some perfumes, she just goes down in a heap. So her husband has moved her out now to Lamb Island off the coast of Brisbane. And she told me one day she was coming across on the ferry, but the lady next to her had perfume and she just collapsed by the time she got to the mainland and had to go back home. So that's the only problem she has. Now her little boys both had orange in their iris. Now, when this lady came to us, she had orange spokes all through both irises. By the end of 30 days of treatment, her eyes were blue. Now that deodorant was showing up right through in the iris. Now both the little boys had orange spokes in their iris. And so she brought the boys up and she said, my boys are always sick. She said they've always got a runny noses, colds, they're always weak. She said sometimes they're so sick they don't even have the strength to cry. And she said, but they've never been in New Guinea. She said, that was years ago that I was there. She said they've never been exposed to that. But they were deodorant poisoned. How do you think they got deodorant poison? From the placenta during pregnancy, passed on through to the children. So I put these boys on a 1-year program of detoxification using green barley. Now green barley, I've got some over there, it's a wonderful detoxifying agent. It cleans the blood, it's rich in chlorophyll. It's also got a very great enzyme in it called superoxide dismutase, which is very anti-inflammatory. It just cleans out the inflammation in cells. It doesn't stop the blood going in, it just cleans the cells out. So I put these boys on green barley and some vitamin C and a good cleansing diet and lots of water and exercise. And in 12 months, the next time I saw them, their eyes were clear. They had no orange in the iris. So those boys are really well now. In fact, I saw the family probably the end of last year at the local natural food store. But she comes up every 2 weeks to get her produce. And she just looked incredibly healthy. Really bright, shiny hair, shiny skin, clear eyes, and the boys were healthy. She said, we've stuck to those 8 laws of health. We've stuck to them rigidly. And she's reaped the benefit of doing that. Here is a lady who was incredibly sick for 16 years, suffering severely. So you see that when we're pushing poisons in, we're just making things worse. When we're pulling them out, well, we're going to get some reactions. And one last story on this subject was a lady that had cancer. Right down here, this is where she would be. In fact, I've often thought it would be fantastic to get a computer program together where you could put all the information about a person's lifestyle and their health and their medical and dental history and so on into a computer, and then the computer would tell you exactly where they fall on this graph. And then you could work out what the most probable reactions and healing crises are going to be that person would get. I'm starting to piece a lot of that together in my mind. When I see people with particular disorders and certain history, you've got a fair idea now what's going to happen over the next few months as they start getting themselves well. And what unfortunately happens is some people, as they start getting well and they get these healing crises, they get afraid, or they run off to the doctor and they go back onto the medical drugs and they just stop all the good work. I ran a program in America last year, and there was a man I was treating who'd had a lot of chemotherapy. And as we started to clean him up, the chemotherapy started coming out the skin. You could smell it, and it started to give him a lot of itch, and he was scratching all the time. So we treated that by putting him in Epsom salts baths and using steam saunas and clay to draw out the poisons, and it was working really well. In fact, he was starting to feel better than he'd felt in a long time. He went home, And one night, apparently, in his home, he got so itchy, it just came back with a vengeance one night, that he ran off to the doctor, and the doctor just gave him an injection of cortisone, and the itch stopped within a few minutes. And he just pushed all of that poison back deeper into the tissue again. He continued taking drugs after that, and then the latest thing I heard was he died in December. See, if he had have continued drawing the stuff out, there's quite a strong possibility that he'd be still alive today and on a path to wellness. Now, this lady that came with cancer, she had cancer in the bones. We saw a bone scan, it was right through her body. The doctors had given her about 2 months to live. And we put her through a program. We detoxified her, and she had 11 big amalgam fillings, so I sent her off to the dentist. We used intravenous vitamin C during each dental procedure to get high amounts of vitamin C into the body, 60,000 milligrams we were using, to detoxify the mercury as it started moving around in the body. When you take fillings out of the teeth, mercury fillings, you find that the mercury that's already in the tissue of your body will start to come out. And this is what you need to be aware of. I'm going to talk about dental in a little while. What happened was we put her on a good program, we put her on a detoxifying program, and she just kept getting better and better. She came back once a week for steam baths and colonic hydrotherapy, and we gave her fever baths to stimulate the immune system, and she just kept getting better. 6 months later, her husband called up and he said, look, my wife's taken a really bad turn this morning, I'm going to bring her over. He brought her over, she could hardly get out of the car. She was crippled over like this, and she walked into my office and she said, my back's all swollen and I can hardly walk and I'm in so much pain. She said, what's happened? And she started crying and she said, I can't understand this. She said, we've been winning. She said, oh, we're sure we're beating this, but look at my back. All the glands are swollen up so big. She said, and she just sat down and went into severe depression and said, well, how long have I got now? I feel like it's only a few days. And I said, no. I said, this is good. So that's a nickname or a saying that people laugh about back at Living Valley Springs now. When I say this is good, it's always when they think something's bad, I say, no, this is good. I said, your body is getting rid of a lot of the poisons that are in the cancer in the bones in the back. In the back was where she had the biggest cancers. They were right down through the spine, in the middle of the spine, big tumours. You could see them in the x-rays. And I said, what we need to do is assist the body to get this poison out. The cancers were breaking up. They were so toxic that the glands could not handle them. The glands were all swelling up, trying to cope with the excessive amount of poison in that region of the body. So I got her husband to make potato poultices, and he put them on her back, all over that area, every 2 hours for the next 3 weeks. Just kept changing these poultices. 3 weeks later, she came back. Her back was completely back to normal. There was no swelling, and she was almost dancing into my office. Quite amazing. And that lady went through a number of other healing crises as time went on, and we just had to recognise that when these things were happening, there was various crises taking place. In some people that I've seen with cancer, severe cancer, they've come in and I've asked them, how long since you've had the flu? And one lady said, 10 years. Haven't had the flu for 10 years, so why would I get cancer? Simply because the flu, it would have been better to get a few doses of the flu, because the flu is a simple way the body's using to get rid of a lot of the poisons. You see, the body can use the flu to get rid of a lot of stuff and really clean up, but her body wasn't strong enough to get the flu. And so for 10 years she'd been reasonably healthy, it seemed, and then suddenly she comes down with cancer and she becomes terminal. As we were getting her well, step by step over a period of a year, finally a year came and she gets the flu. And she called up, she said, I got the flu. I said, fantastic. That's the best news I've heard. Because if she's got the flu, that means we're getting there. And if you see here, if she was down here in this region here, 6 months of cleansing, she starts to get major reactions up here in different organs of the body. 6 months later, she starts getting reactions up here. 6 months later, it's over here somewhere. And finally, when we get her up to the flu, we're up in this region here, we know that we're winning. So we just said, let that flu come. Just let those poisons come out. Drink a lot of water, go back on juices for 3 days, have steam baths, and let's assist nature in her efforts to expel those impurities from your body. And that's what we did. You see, so it's a completely different understanding of disease, isn't it, from what we've conventionally been taught. So that's the study on toxicology. Just one last thing here is, we call this progressive destruction, and this is regressive repair. You see, once you go past this line, the biological section they call it, once we get past there, you find that the diseases take a lot more effort to clean up, because the poisons are deep down into inner tissue in the body, and we need to draw it out, and that can take months or years, and we need to work with the body as we clean up. Right, well, I'll stop there, and then we'll have a little break just for a few minutes, and then we'll come back and we're going to talk about dental health.